Genes. Genes, we all know it is made up of a DNA. And we all know genes play a very important role when it comes to our human body, how we behave, our health, etc. We are now today going to talk about how these genes affects the cancer or a correlation between genes and cancer. To discuss this subject, we have a very important person who is joining in for today's panel. Before that, welcome to Medicas Video Podcast. My name is Varun. So without wasting any time, let me invite that very important person. Namaste, Dr. Vipin Goel. How are you doing today, sir?
Hi Varun, nice to see you. Doing
I-
absolutely fine.
Thank you, sir. So,
Congratulations for
ladies
your
and gentlemen,
podcast. Congratulations for your
absolutely, sir.
podcast. You're doing wonders and spreading the awareness in the society. Congratulations.
Thank you so much, Dr. Vipin. I just, my way of actually giving it back to the society. Ladies and gentlemen, we have Dr. Vipin Goel. He's the clinical director and the head of the department for the surgical oncology with the Star Hospitals. He's got more than 12 years of experience, especially in the surgery for the cancers related to head and neck, gastrointestinal cancers, gynecological cancers, genitourinary cancers, skin cancers in soft tissue, sarcomas, breast oncology, including oncoplastic surgeries, laparoscopic surgeries, and the list is never ending. So, with this kind of an expertise and with the knowledge what Dr. Vipin will bring onto our table, let us ask him some common questions which are related to genes and their role when it comes to cancers. Right now, this is a very important subject, especially we all should know, we all should be aware of what we should be doing, especially when we have cancers running in our family. Dr. Vipin, there is a very important and a myth, probably you can bust that myth. Will cancers continue in the family? Is it genetic?
Whenever I see the patient, I sit in the OPD, I'm treating a lot of cancer patients. Patient's daughter, son asked me a basic question. Sir, whether I will get a cancer? Yes, it's a very valid question because once you're sitting in OPD, they will have that fear. My mother is suffering, my father is suffering from cancer. What are the chances I will get a cancer? So, in brief, cancer is divided into two categories: sporadic, which is non hereditary, and second, hereditary, which runs in family. If your mother or father is having cancer and there is very high chance you are getting that cancer, it is called hereditary cancer. If some cancer is because of the risk factor or the cause which we don't know, is called sporadic, and that does not run in family. If I see percentage wise, 70 to 80% of cancer are non-hereditary.
Okay.
Only 10 to 20% of cancers are hereditary in India.
Okay, Dr. Vipin. That's an interesting number. Sir, what are the cancers that are genetic and what are the cancers that are non-genetic? I know it probably would be a lengthy answer, but you can give us, some light on that.
I will put in simple words.
Sure,
There
sir.
are risk factor for cancer, and if somebody is having that risk factor, to give you example, tobacco is a risk factor for oral cancer. So
Okay.
oral cancer is not hereditary cancer because it is
Okay.
because of tobacco. If I take all the hereditary cancer in India, the most common is breast cancer. Second
Okay.
is ovarian cancer. These two are
Okay.
main cancer which runs in family. And
Okay.
other category, if I put oral cancer, lung cancer, or sometimes pancreatic cancer or non-hereditary cancer, which does not run in family. If I
Okay.
take top six cancers in India, ovary, breast, colon cancer is more common hereditary cancer, and other
Okay.
cancer like lung cancer, oral cancer, pancreatic cancer are non-hereditary.
Okay. That's a good classification, doctor. Now, why does cancer get carried on with genes? Because when a young person gets born, of course, we all know. People like me who are non-scientific people know that genes are carried, but cancer will not be showing symptoms from the child's birth, right? And you are saying that these breast cancers, colon cancers, ovarian cancers are carried along with genes. Why will that happen, Dr. Vipin?
I will put this in simple word. What is cancer? Cancer is a fight between the bad cells and the good cells. If in your body bad cell increases, it leads to cancer. So to prevent bad cell, what your body does is These cells are continuously multiplying in your body. Example, your hairs, skin, colon cells continuously multiplying. But this multiplication is controlled fashion. It is controlled by your DNA. Bad cells are killed by the body because it is controlled by DNA. But if the control is gone, like your DNA is damaged, the bad cells are not killed by the body. This keeps on multiplying. So the genes plays very important role to remove the bad cells and keep only healthy cells in your body. But if your genes are only damaged, then this process is hampered. And these genes carries from generation to generation. So the people who are having these mutated gene are at high risk for cancer.
Oh, okay. Now I understood, sir. Now, let's say in a scenario where we are talking about a breast cancer is there in the family. Now, what should that woman do to ensure, firstly, to know whether she will also get the cancer or not? And if she realizes that she is also prone to this cancer, vulnerable to this cancer, what should she do?
Very good question. So what we do is first what we call this is an index case. You should remember about this word index. The patient who is suffering from the cancer is called index case. What we do is we check the mutation in the index case first. We don't test the children's. It is a waste. If
Oh,
the index case is having the mutation, then we call it as a hereditary cancer. Then we tell to children to undergo the same gene testing to see if she is also mutated or not mutated. So first we test the index case. If it is positive for mutation, we test the children's for the mutations. So the thing what we do is we do the mutation testing in first the patient, then the attenders.
oh, okay, okay. Now, let's say in the patients, obviously, we will realize that she's has that cancer, and we will test the children, and we also realize it that children are also vulnerable to this cancer. They carry the same genes. What should they do?
Correct. Very good question. You're talking scientific. I appreciate your knowledge. You're talking like maybe MBBS doctor. So what we have to do is, if I see a normal person is having the mutation, this becomes a high risk for cancer. The patient is having high risk, not patient, I will call it as a normal person is at a high risk for developing cancer. We cannot prevent the cancer in them. So what we do is we call it as screening. We screen
Okay.
the person at regular interval to see if they are developing cancer. The dictum here is to detect the cancer in early stage. If I detect the cancer in stage 1, the cure chance is more than 95%. This drops to 0% if you are in stage 4. So what I do if there is a mutation in that person, I do regular screening. To give you example, the regular mammogram, what we do for breast cancer screening, we start at 40 years. But if somebody is having mutation, we start at the age of 25 years. I
Okay.
cannot prevent cancer in that person, but I can screen, I can detect it early, I can treat it early, and I can cure the cancer.
Okay, okay, Dr. Vipin. Dr. Vipin, we all know in a country like India, we only would want to go to a doctor or get a test done when we are unwell or when a doctor, suggests us to go and get a test done. We don't usually periodically get tested for any of the screenings, the right term that you have used. So by the time we realize, especially when it comes to these cancers, breast cancer, colon cancer, as well as the ovarian cancer are the genetic cancers you have suggested. How frequently should our Indian women or any woman around the world should get tested, whether or not they have identified this cancer in the family, irrespective of that? How frequently they should get tested and what are the tests they should get it done?
This is a very unfortunate situation in India. If I see the overall scenario in US, 90% of cases are detected in early stage. Whereas, can you guess how many percent of cases are detected in stage 1 in India? Just make a
I
wild
should
guess.
imagine less than 10%, sir?
Exactly. Only 10% of the cases are detected in stage 1. 70% of the cases in India are detected in stage 3. This is an unfortunate situation because the awareness is not there about cancer. They neglect the symptoms, or in second tier or third tier cities, unavailability of the oncologist.
Okay.
We now
Okay.
coming to your question, we put the screening into two category. One, regular screening, which is for the average risk patient. Average risk means like a patient who is not having mutation, and we
Okay.
call it as a second is high risk screening, which are patients are having mutations. So I will put this in two categories because the numbers are different for both. If, for example, breast cancer, I'm doing a normal risk screening. A person who's not at a high risk of cancer should start the screening at the age of 40 years.
Okay.
But if somebody is having mutations, the screening should start as early as 25 years or maybe at 20 years also. This
Okay.
data I am extrapolating from the US data. We don't have Indian data available. So until we have
Oh.
our data, we follow US data. Now coming to cervical cancer, ovarian cancer applies same. For normal risk patient, you can start after the age of 40 to 45 years. But if some mutation is there, we should start as early as 25 years.
Okay. Okay.
So the basic principle is average risk, you start late screening after the age of 40 years. And for high risk mutated persons, we start at the age of 20 to 25 years.
Okay, okay, Dr. Goel. Sir, for the benefit of our audience, let's classify male and female. What are the tests should a male patient or male person should get them done to know if they are vulnerable to cancer or not? What are the tests females should get it done to realize whether they're vulnerable to cancer or not? How frequently they should get it done?
This is a very basic question asked by a lot of my patients, but you should know there is cancer is not one disease. There are more than 200 cancer in the body, and there is not a single test which can detect all 200 cancers.
Okay,
To qualify for the screening, it should be a good health hazard. The screening test should be accepted by the patients, and it can be repeated. It's not like only one time it is possible, and very important, it should be cost effective. So
okay,
we put some cancers which are eligible for screening, which is a definitely health hazard. In female, two cancers are very common which are eligible for screening. One is breast cancer, for which mammogram is recommended. Second is cervical cancer, for which pap smear is recommended. Remember these two words, mammogram, pap smear.
yes, sir.
In male, most common is oral cancer, for which we can do local examination. So if you feel you can go to any dentist or any surgeon, he can do a local examination of your oral cavity to see if any lesion is there or any pre-malignant lesion is there. Prostate cancer, we can do screening by simple blood test called PSA.
PSA. Okay.
This is for the average people I'm talking. Colon cancer, there are few tests like CT scan or colonoscopy or sigmoidoscopy, where we put the camera inside the colon and visualize if any lesions are there. So depending
Okay.
on the cancer, we have a separate test. But there is not a single test which can detect all 200 cancers.
Right, right. So in this case, Dr. Goel, I think it's better we recommend a general public to get a genetic testing done. Where can they get these genetic testings, sir? Are there any separate labs for this? Or whatever the diagnostic centers we have around can do these testings?
Yeah. For the first question, I disagree with you. It is not for the
Oh,
general population.
okay.
This genetic testing is costly and
Oh,
not
okay.
recommended for everybody, because
Oh,
this can bring more of anxiety to the patient, because there are few mutations whose importance we don't know whether that
okay.
mutation is going to cause the cancer or not, so we don't have answer for that. So the
Okay.
genetic mutation is not for a normal public. I don't recommend
Okay.
it. It is
Okay.
for the first for the patient. If
Okay.
I have a high suspicious that this cancer patient may be a genetic case or maybe because of the mutation, I do in that. If that is
Okay.
positive, then only I recommend it to relatives of that patient. Again,
Okay.
only
Okay.
relatives, first generation or second generation, not for
Right.
everybody. So it is not
Right.
for the
Right.
general
Understood.
population. And there are many labs available outside which do this molecular testing or genetic testing to see the mutations.
Oh, understood, doctor. So I think I'm now able to connect the dots. How much does it approximately cost to get this genetic testing done, Dr. Goel?
Yeah, genetic testing again depends on the mutation what you are testing. To give you
Okay.
example, for breast cancer mutation, we mainly do BRCA testing, BRCA1 and BRCA2.
Okay.
Luckily for this, what is happening is the cost is coming down. 10
Okay.
years before when I was doing this test, it used to cost some 60,000 or 70,000. But now,
Okay.
because of many people have entered into the market, because of competition, the cost has come down. Now the mutation can be done as low as 12,000 for
Okay. Oh,
breast.
that's
And if you
yeah.
want to do Single gene mutation analysis or multi gene, the cost is different. Single gene can be anywhere between 12 to 15,000. Multi gene can be anywhere from 30,000 to 40,000. But again, depends on what gene you want to test.
Great, great, great. Thank you for shedding those lights, Dr. Goel. Finally, for our audience, Dr. Goel, what is that you would recommend when it comes to getting this genetic testing or genes related to cancer, especially for those people who already have cancer running in their family or the patients that are already suffering with cancers? What is that you recommend with the experience that you carry with you, Dr. Goel?
Yeah. So I'll put it in the two category. For first category, patient who are suffering from cancer or who are cured from the cancer. For them, first discuss with your treating doctor whether this cancer what I got is because of mutation, because of the can it be hereditary or it can be a sporadic. You discuss with your doctor. Seeing lot of parameters, your doctor will decide whether it is hereditary or not. If they feel it is hereditary, please go for the mutation analysis. And if it is positive, tell your children to do that same gene analysis. And for the normal public, the second category, I will not recommend you to do for this test. What I will stress more is screening, and you should know what are the warning sign of cancer. So for the normal public, I will stress more on the warning sign of cancer. If any of you are suffering from any of these signs, please meet your doctor as early as possible. And second, screening. If you have a high risk of any risk factor like tobacco consumption or any other risk factor, then go for screening. So both are different. For person who is suffering from cancer, do genetic analysis depending on your treating doctor, whether required or not required. And for the normal public, concentrate more on avoiding the risk factor, knowing what are the warning signs of cancer, and third, screening for all the cancers.
Great, great. Thank you so much, Dr. Goel. That is as clear as we can understand in simple terms. A very important information. Ladies and gentlemen, I'm sure you had heard Dr. Goel give us very important information, especially when we have cancer running in our family. Earlier days, cancer used to be one in a town or one in a city. Now the situation is not the same as it was 10, 15 years ago. Our lifestyles kept changing, the cancers also kept changing. That's what we have been hearing from the doctors. So please ensure that you keep a very wide eye open around you, especially when it comes to your lifestyle modifications, and also when you already have a cancer running in your family, to get this genetic testing related investigations done. You can consult with Dr. Goel on medicasapp.com. You can download Medicas app from Play Store as well as App Store. You can have a personalized consultation with Dr. Goel. He's based out of Hyderabad. You can visit him, whoever is in and around Hyderabad. Otherwise, you can have an online consultation with him based on his recommendation. You can go and meet him at his premises. So he's definitely going to guide you in a right way. He has been doing this for a lot of patients, and he has got excellent case studies and testimonials. Please be aware of your surroundings, aware of your health, take care of yourself, keep watching and subscribe to our channel. Dr. Goel, thank you so much for talking to us and giving this information, sir. Namaste.
Thank you, Varun.
Thank you.